You're tuned to Planet Vera Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We are broadcast on 101.7 FM Real Radio WCZR, and we're also podcast on Spreaker. I've got my co-host with me, Jeannie Roller. She's talking from Indiana. Jeannie, I'm going to let you run with this today. We're talking a couple of topics that you brought to my attention. One is about, here we go again, disrespect. And this is in another avenue about how doctors are complaining they are disrespected because they're being called by their first name and instead of their title or their first and last name or what have you, which they deem, a lot of doctors, not all of them, deem more appropriate, more respectful. And you've got some answers about that on how patients are also disrespected by being called by their first name. Not that they've been asked to be called by their first name, but that they are just routinely done. And then we're also talking about the case in the United Kingdom about the nurse that is accused of killing infant babies. So, I mean, quite two different topics, but quite necessary things to talk about. So go ahead, Jeannie.
Well, MedPage Today done an article in early October of this year about female emergency doctors and that they encounter a lack of respect, that they are most likely to be called by their first name, more likely to be called by their first name than a male counterpart, that they are more likely to be dismissed, acted rudely to, etc. Now, my thing with this is, and you and I have talked about this, Cindy, is that where I'm from in Indiana, you're more likely as a patient to be called by your first name. You said that you don't remember ever being called by your first name in Florida, where you're from. Mm-hmm. But around here, for a patient, it's pretty routine to be called by your first name. Okay. The second thing I have is that they do studies on trauma that doctors and emergency technicians, nurses, anyone who works in the medical field suffer. But they don't do studies on the trauma that patients suffer from the disrespect from the medical personnel. That really bothers me, that patient trauma is not studied. I mean, I don't like being called by my first name by those people because we are not friends. They are, in fact, my employee. And I believe from the very moment they come across me, they need to address me with respect because that sets the tone for our encounter. Because using a title of respect, Mr., Mrs., Miss, whatever, and then doctor in return says that I respect you as a person, you respect me as a person. And I think that by setting the tone, by first addressing a patient by their first name rather than asking what would you like to be called, sets the tone of I am your superior. Mm-hmm. That is how I see it.
Well, I want to just do a little bit of clarification on what you're talking about, the female doctors saying that they probably are more disrespected than the male doctors by being called their first names. I think that's absolutely correct. I'd have to say they're right about that. Yeah, and I also want to say that they probably are, they're totally correct about having less respect. I would say hopefully it's gotten better in the years, but something tells me that maybe it hasn't, especially with you saying that going through medical school and those kind of things, that female doctors probably do not, garner as much respect as a male doctor. I don't know why, and it shouldn't be that way. It shouldn't be any of that where female males are, dispelled against.
Right.
You're in the same community, you're in the same education or whatever. I personally, when you asked me that question, Jeannie, I personally went through my mind to try to remember at each doctor's office, and I have a bunch of doctors on how they actually address me, and I can remember for most part that it was always Mrs. or Ms. or something like that and my last name, and maybe sometimes they would say my first and last name. So I can't remember really that I've been called specifically by my first name. But it's a valid point. It's we all talk about that and respect in other aspects of the life we live. That a lot of the respect is going out the window. But those are valid points.
Right. And, the other part of that is a lot of times medical personnel will not wear identifying tags so that you
Yeah.
actually know what they are. And,
Yeah.
to be honest, there
Hmm.
are more female nurses than there are male nurses. So most of the time when people see a female medical person without identification, they are going to assume
Hmm.
that person probably is a nurse.
Yeah, well, we've said that too about
Wear
the people,
wear a tag.
yeah, the staff that's in the OR. Actually, I mean, call me old, which I kind of am. Different generation. That when you see someone standing in the OR, you think it's a nurse, and it may be a tech or whatever. And my other thing about that is, a lot of times they wear the lanyard, so that's the identification that they can use to cover that patient, write things that said, yes, we are identified. A lot of times the lanyards are tucked inside their scrubs or their shirts or their uniform or whatever, and a lot of times the lanyards are backwards. Now, maybe that doesn't mean a
Right.
big deal to the people the people who are wearing the lanyard, but it is a big deal to the people the patients that are afraid, first of all, to be there. Second of all, you're looking around the room. You do have drugs in you probably at this point, and I know we keep saying that because it's true. You do have all these drugs in you, and you're looking for safety aspects. You're looking for who's actually working on you. Most of the time, they're not, and people don't come up to you and say, "Hi, I'm, Louise Miller. I'm an RN. I'll be taking care of you." They used to do that back, it seems, 100 years ago. Or I'm, Daniel Webster or whatever, and I'm going to be your OR tech today. I don't hear that happening. It's all taken for granted because they have a lanyard and have a thing. Is that nitpicking? Yeah, maybe it is, but wow, think of the safety aspect of what the patient's looking for and the calmness and just we don't want to be there in the OR anyway, and none of us do. We're afraid to do it. We are. So anything that the medical community can help us ease through that, I don't see the harm in taking another minute, but it seems to be, and we've beat this dog so many times, that the administration literally has it down on a tick, 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 tick. Well, that's another 15 seconds. You can't do that. So that's too much time taken. Some of this stuff needs to come back to warrant saying that it's good medical care, in my opinion.
Right. Well, and the other article came from MedPage that I wanted to talk about today. It's about there is a trial for a British nurse accused of murdering infants.
Yes.
She poisoned them deliberately with insulin. She tried to kill more than she tried to murder more than she actually ended up killing. Mm-hmm. And when parents or someone would catch her, her phrase was, "Trust me, I'm a nurse."
Yeah.
And, this just sets off alarms in my mind because we are told as patients not to question because I'm the professional. I know what I'm doing. So if you do see something wrong and you question it, that's kind of the standard phrase that you get is "trust me. I'm the doctor. I'm the nurse." That just sounds off alarm bells in my mind.
Well, it's a trigger. It's a trigger for someone that's had heinous care, that's been abused, that's been bullied in the medical system. I mean, rightfully so, to the person that's happened to. You don't know what it's going to do to somebody. I mean, I know what it did to me. You know what it did to you, and it's horrible. Yeah, you want to blindly trust. I have a really hard time anymore. And I try not to read all these stories either, but there's just so many of them. It is unbelievable, and it keeps coming back to my mind. I know it probably does to yours as well, Jeannie. Yep. Well, that doesn't happen. We don't do that to patients, and that's wrong. We didn't do that, and you're making it up. Well, we don't have any reason to make it up. We just don't have any reason. If I can unthink all the stuff that I saw happening, I would gladly do it, but you just can't do it. And so hence we talk about it because it's the best thing to hopefully get something done about it. Right, Jeannie? We have like 10 seconds left. Hopefully get something done about it.
Well, in this case is one where she was previously arrested 3 times before, but was never charged.
There you go.
Until years later.
Yep. So on that note, I'm going to say stay tuned to Planet Vero Radio.